Is your hair clogging the drain daily? Have no fear! You naturally lose 100 hair strands a day. Good day everyone! Today I will be talking about some causes of hair loss. So hair loss is one of the most common reasons why people seek consult. Alopecia, the medical term for hair loss, can affect not only your scalp but also other parts of your body. And it can be temporary or permanent.
What?
So the human scalp contains approximately 100 to 150,000 hair follicles. Our hair follicles undergo lifelong cycling, namely the growth phase, resting phase, and shedding phase. 90% of our hair are in the growth phase, and the rest, which corresponds to about 10%, are in the resting and shedding phases. So when hair is falling out, this is the shedding phase. And the hair is going to recycle and it starts growing again. So as mentioned, it is actually normal to shed hair. This shedding is not a sign of hair loss. When your body sheds significantly more hairs every day, you may have excessive hair shedding or telogen effluvium. It is usually due to stress after losing a lot of weight, giving birth, getting a high fever, or recovering from an illness. But as your body readjusts, the excessive shedding stops. And within 6 to 9 months, the hair tends to regain its normal fullness. If the stressor stays with you, however, hair shedding can be long-lived. So people who are constantly under a lot of stress can have long-term excessive hair shedding. Meanwhile, hair loss occurs when something stops the hair from growing, and this is the condition known as anagen effluvium. Aside from hair loss, you may experience other symptoms such as a burning or stinging sensation before hair loss, intense itching, redness, swelling, and sores that open and ooze pus. So hair loss has a lot of causes. I will be discussing the top 5 causes of hair loss, and the most common of which is hereditary hair loss, or what we call androgenic or androgenetic alopecia. So it means that you have inherited genes that cause your hair follicles to shrink and eventually stop growing hair. So both women and men develop this type of hair loss. In women, the first noticeable sign of hereditary hair loss is usually overall thinning or a widening part on the scalp. For men, the first sign is often a receding hairline or a bald spot at the top of the head. Treatment can help stop or slow down hair loss. So the earlier the treatment is started, the better it works. Without treatment, however, you will continue to lose hair. Another cause is age. With age, most people notice some hair loss because hair growth slows down. At some point, hair follicles will stop growing hair, which causes the hair on our scalp to thin. Hair also starts to lose its color. A woman's hairline starts to recede. But caught early, treatment helps some people regrow their hair. So one of the diseases that causes hair loss is alopecia areata. It develops when the immune system attacks hair follicles. You can lose hair anywhere on your body, including your scalp, inside your nose, or in your ears. Some people even lose their eyelashes or eyebrows. If you receive chemotherapy or have radiation treatment to your head or neck, you may lose all or most of your hair within a few weeks of starting treatment. Nevertheless, hair starts to grow months after finishing the chemo or radiotherapy. Wearing a cooling cap before, during, and after each chemotherapy or radiotherapy session may help prevent hair loss. If you color, perm, or relax your hair, you could be damaging your hair. Once you damage a hair follicle, hair will no longer grow. And having many damaged hair follicles creates permanent bald spots. But nevertheless, you can change how you care for your hair, which can prevent hair loss. I often get asked if there are diets or supplements that people can take for hair growth. As much as I want to say that yes, there are such things, it is only true if your hair loss is due to deficiencies like in iron, zinc, and niacin. In fact, in the absence of deficiency, supplementation may actually prove harmful to the hair. Oversupplementation of vitamin A or vitamin E has actually been linked to hair loss. It is therefore important to identify the cause of hair loss so that proper management can be given. Although regrowth of hair is possible in some cases, treatment may be recommended to help hair grow faster and to prevent further hair loss. So some of the medications that we give include minoxidil solution, which offers convenience and helps early hair loss. So this drug tends to be more effective when used with other treatment. Many people see some regrowth when using this, but it takes time to see the results, usually about 6 to 12 months. Another medication that we give is finasteride. It is a prescription medication that has been proven and approved to treat male pattern hair loss. Procedures may also be done to help regrow hair. These include corticosteroid injection every 4 to 8 weeks, laser therapy for a few sessions, and hair transplant, which can be an effective and permanent solution. So what do you think would be the best way to grow hair? Comment down below. And remember, good doctor, free online consultation.